I want to start off with talking about UF's Bachelors of Public Health program.
Mhm.
So why should someone choose UF's Bachelors of Public Health program?
Yeah, so I mean, UF is ranked number 7 nationally. So between the network, the alumni that is going on at UF, the resources, I mean, it's unparalleled. The Bachelor of Public Health program specifically is a limited access program. So what that means is that you have to apply into the program unlike other majors. So what that does is that allows for the program to have a high quality of applicants. We can really make sure that the resources that we have are select for a number of individuals. So whether that's instructor to student ratios, access to your advisors, access to general resources, that's what I think sets us apart. We're also part of the Health Science Center, so the area in which you would be taking classes and individuals that you would be interacting with are not only public health, individuals, but students that are in College of Nursing, College of Pharmacy, those who are looking to in the medical school. It's all very interdisciplinary. So I think that that's awesome.
Okay, great. And just so if no one knows, University of Florida is in Gainesville, Florida. So like central Florida, I would say.
Yeah.
North
Hmm.
Central. I don't know if that's a
Yes, yes, it's North
thing. Yeah.
Central.
So what are the prerequisites to get into the program?
They're very general prerequisites. Most of them are the general education requirements that we have here in Florida. But to specify general biology, stats, we ask for 6 credits of social and behavioral sciences courses. So those are the state core that I was speaking of, Comp 1 and 2. One course that is a little maybe not so common that we ask for is an advanced writing course. There's a lot of writing that goes on in our courses, so we want to make sure that that's something that you've had experience in. And then we just have a 3.0 GPA minimum, which is our basic requirement.
Okay. And yeah, I definitely think writing is important. I remember when I was interning at Florida, Lindsay, who was my boss at the time, definitely said that UF needs to do a little bit more to get people to write better because she was correcting a lot of the things I was doing. So I definitely think I see value in that, and my writing has improved. So that is something to
For
take.
sure, that definitely comes with practice. And some comp classes, they don't. Some professors don't give feedback. So you do the assignment, you get a grade, but it's the feedback that really is going to help you become, a better writer. So yeah, super important. Still trying to learn to this day, improving.
Yes, and I think it's just about those slow improvements.
Right.
Yeah. So can you describe the Bachelor's of Public Health program structure a little bit?
Yeah, so as I mentioned before, it's a limited access program. So when you, for instance, apply to UF, you can track for the major, but that doesn't mean that you're officially in it. But your first and second year is typically just your general education requirements, any electives or classes that you want to take and explore. A lot of individuals that are interested in public health also have an interest in medicine, so either pre-med, pre-dentistry, pre-health professions. So a lot of those classes are going to be filled in with those, heavy science courses. Your sophomore year in the spring, February, early February is when the application is due for the Bachelors of Public Health program. So you apply and then you would start the program your junior year through your senior year. So you still have space in your curriculum to keep taking those prereqs that you need for other, professional schools. But in your curriculum, classes are made up of US healthcare systems, epidemiology, critical issues of public health. We also have, which is my favorite, the service learning practicum. So that's basically an opportunity for you. It's kind of a mini internship. So it's an opportunity for the student to work with the community agency and make some type of deliverable for them. So service them in any way that that specific agency needs. So that can be through writing, through setting up a needs assessment, through surveys, through things like that. So really applying those skills that they've learned in courses. And yeah, the courses that I mentioned are just a few, but a variety of things. For instance, U.S. healthcare system, that is such a complicated, thing to navigate, that a lot of people who are interested in, dentistry or medicine, I think, if you don't understand how you're getting paid or how your customer is getting the funds to pay you, or, what that all looks like, that's just not something that they would teach, traditionally. So having that information, I think is amazing.
Yeah, and I agree. I was a pre-med biology major, and we never learned anything about the US healthcare system. We learned like our biology stuff, and I only learned about public health when I started my MPH, really. So I definitely think people in Bachelors of Public Health program definitely have a leg up. And even if you're not going into public health, there are a lot of classes that cross-sect a lot of different fields there. So,
Yeah, absolutely. One class that I took myself, but I TA'd for, that I know a lot of students took away from it was therapeutic communications. So it's basically kind of a role playing course. Well, one of the elements is role playing, where you have to communicate to your patient. Um, I'm so sorry, we're going to have to amputate your leg. So how you build rapport, how you break the news to them, just communicating that's not easy, information to give someone. So being able to do that properly and, sympathetically, and, just it's just skills that I know that when I go to the doctor, sometimes they lack. So I just would want, whether you're a public health professional or going into medicine or nursing or anything like that, for you to have that in your back pocket for sure.
and yeah, and I think that's something that the healthcare system needs to improve on. A lot of the doctors are just okay, they know their biology, they know the medicine, they know pharmacology, but they don't know the interpersonal skills dealing with patients. And I think there's a huge
Right.
disconnect there. So
Yeah.
definitely, thanks for talking about that. So
Mhm.
what sorts of internships opportunities are available? And I know you spoke about a practicum a little bit earlier.
Right. So that we have a lot of community partners in UF. So anywhere from Health Street, Swanee River, AHAC, well, Florida Council, these are all nonprofit organizations that are in Gainesville, that do a variety of things. Um, we also have institutions within our university. So for instance, the Southeastern National Tuberculosis Center, that is a CDC funded program that does AIDS education, that does tuberculosis, and it deals with comorbidities like AIDS, things like that. Um, there's a lot of things that are established, but also kind of depending on what's going on in the college or in the university in general. Some researchers have projects that you can work on with them. So, I mean, the possibilities are really endless, and more, especially now, this past spring and currently summer, we've had to get creative with what types of internships or service learning um, projects we have or opportunities. Now we're doing a lot more virtual things that you can collaborate together. So maybe it's not something particularly in Gainesville or at UF, but if you found an opportunity outside of these parameters, kind of, for instance, a friend of mine was doing an internship at CNN in Atlanta, but was also doing a project for a healthcare blog. So that is, as it meets the criteria, the possibilities are endless.
Yeah, and I agree. And when I was and do my MPH, I know there are a couple of students that did internships in, I want to say DC, and the staff were definitely very supportive. I want to say they're the ones that shared the experience and also like gave her a recommendation to be able to get into that position, which really helped her in her career. So switching gears a little bit, I know that UF has a dual program, Bachelors and MPH, and I thought that was really cool just because you're able to get your MPH and your bachelor's within 5 years instead of doing like 6 years. So do you want to just talk a little bit about that program?
When it comes to health professions, public health is not always at the forefront. So a lot of students come in wanting to be pre-med, pre-dentistry, pre-vet. And for one reason or another, either that doesn't work out or they truly find a passion in public health. So obviously we offer the Bachelor in Public Health program, but something else we offer is the combined Bachelor's MPH program. So really, regardless of whatever bachelor's you have, what you can do is you would apply to the combined degree program summer of your junior year going into your senior year. What that means is that your senior year, you would be taking 5 of our MPH courses. So that gives you a 15 credit head start to the MPH program. Typically, you go straight into our MPH program. However, some individuals have been able to find different opportunities. So whether they go directly to a PhD program with those graduate credits, or they decide to go to a different school, you're taking graduate level courses as an undergrad. And again, that's 15 credits. So the benefit of that is obviously saving time and money. So you are charged a graduate rate, but typically with individuals, they are able to use their financial aid. In Florida, a lot of us have Bright Futures, so it covers a portion of that. And then at that time, you're not. I remember my senior year in college, there was just some classes that I was like, I mean, I like the course, but do I really have to take this? Like, I mean, I was just filling up my curriculum to a point. So that wasn't always like the best way to spend my money. So if you ever are having, questions about, maybe that class isn't for me, making sure that you use those classes wisely and, taking graduate level courses is amazing. Very similar to what you would see, high school and dual enrollment. That's kind of what it looks like for us on the graduate level. But yeah, I mean, you as an undergrad are able to be in smaller classes because graduate level courses are, typically a lot smaller than undergraduate, which means you have better access to your teacher, your instructor, better access to your teaching assistant, and you're working in the same classroom with individuals that are older than you and, essentially in theory wiser than you. So you can develop those relationships and learn, both professionally and academically.
Okay. Yeah, and definitely seems like there's a lot of flexibility there. So when you're transitioning from your junior into your senior year, you have to choose the concentration that you're going to pursue in your MPH also?
So as soon as you apply to whether you're a combined degree student or a traditional MPH student, you have to choose your concentration. The traditional MPH program is 48 credits, with the combined degree students having a 15 credit head start. So it moves pretty quick. A traditional student finishes the program within 5 semesters, with the 5th semester being the internship. So there's really no time for you to either switch a concentration or not start working on the concentration as soon as you start. Very rarely do we have individuals that want to switch, um, but you do, regardless of which concentration you choose, you do have those 5 core MPH courses